First of all, I would like to start off by saying, Tessa said that you had to be 26 to get health care. Obamacare only says that you can stay on your parents' health care until you're 26. Doesn't mean that you have to, not get health care. And she talked about Medicaid and Medicare, and Obamacare only really expands Medicaid. Medicare is more to help the elderly instead of just the poverty, people with poverty. So that's too much point. With the enactment of the Affordable Care Act, aka Obamacare, there will be an expansion of Medicaid. Many people are not fully aware what this government program really does though. Medicaid helps provide health care services to low-income families. Each state can set its own requirements and deem who qualifies for it, and being under the federal poverty level. According to the New York Times, there has recently been a study by Harvard done surveying the states where there has been an expansion of Medicaid, and this study was conducted before Obamacare. They compared 3 states, New York, Maine, and Arizona, with their neighboring states who have yet to expand Medicaid, and found out that they had a 6.1 decline in deaths. The state of Oregon also conducted a study by giving 10,000 people randomly drawn from a lottery the benefits of Medicaid, finding that compared to those who did not receive Medicaid, the recipients see doctors more often, report better health, and financial stability. Medicaid is also closely related to Children's Health Insurance Programs, or CHIP, but not the kind, helping underprivileged children have access to services if they do not qualify for Medicaid. Going into my next point, according to hospital records, 30% of patients admitted cannot pay for their stays in operations, which causes hospitals and the government to lose money. Although Obamacare can be expensive to start out, in the long run it will curb the overall health budget. By making a requirement to have health care, most everyone will have some sort of coverage. That means that there will be less people who cannot pay for their medical bills. You can see how Obamacare will further improve the economy while helping millions of people live without the fear of not being covered and have overall healthier, more enjoyable lives.
You said that CHIP helps children, but CHIP draws on federal and state funding, and Medicare was about a fifth of states' budgets. So if you're drawing more and more from that, then you can't use state funding for schools and roads and other things that people need every single day. People aren't sick every single day, but they do use roads.
Well, don't you think your health is more important than well?
Okay. All right, thank you. Okay.
The purpose of Obamacare was to provide affordable health care for all Americans. But just how affordable is it? The average American makes $51,000 a year. So let's say that you're a newly graduated college student who just got a job that makes $51,000 a year. Super duper for you, and you just joined the working poor. But you make $51,000 a year, so how are you poor? Well, you graduated in late May. And what's due April 15th? Your federal taxes. That's 25%. And when it's all said and done, you only have $38,250 left. Your house payments for the year total up to $17,000, leaving you with only $21,250.
Yes. Okay, so who says they have to live in a house? Why can't they live in an apartment where it's much cheaper for them to able to afford something with also food and other resources?
Because even if they did live in an apartment, it would still cost a lot. It would still cost a lot in the long run. And besides, in an apartment, you could easily be evicted if the price is rising and you can't afford it. Your car payments, or your car bills, add up to $6,600 a year, which drains your budget to $14,650. When your stomach starts to rumble, you remember that you spent $7,852 on food this year, making your wallet hungry when it only has $6,798. And after your water, gas, sewage, electricity, and other necessity bills come, you only have $2,718 for the whole year to live on. No, yes. And by the time your state taxes, your cell phone bills, and other such things roll around, that's probably more than gone. The average, but you still need insurance. The average plan has a $290 premium, which is how much you pay per month, a $3,670 deductible, which is how much you have to pay before the insurance starts to help you, and $4,740 maximum out-of-pocket costs, which is how much you would pay out-of-pocket maximum. The crappy insurance is $178 a month with a $6,350 deductible. That leaves you with only $49 a month to live on. Obamacare lets healthcare companies raise their premium to 8 to 10% a year. So in 2 years, your premium is $270 a month, and that's unaffordable. But who benefits from this? The insurance companies. If 16% of uninsured Americans buy the cut rate insurance plan, whoever offers that plan makes over $8.5 billion a month. But who doesn't benefit from this? Doctors and hospitals. Because of the fact that lawyers, lobbyists made Congress take out tort reform, doctors hurt badly. If a doctor orders a test, the companies can deny the test because they deem it unnecessary. And they take your premium that gets bigger by the year and don't let you have the test that you need, like x-rays or CAT scans. And if the doctor misses something or misdiagnoses a disease, they can be sued. The people usually win, and they receive anywhere from $5 to $10 million. And the lawyers get a nice chunk of that, usually $1 to $2 million. Tort reform protects the doctors, but the lobbyists gave it the boot. And what if a person doesn't have health insurance and has a bunch of tests and can't pay? What happens to the bill? It doesn't go to the health care companies. The hospital has to write it all off. Obamacare only helps large corporations and hurts the average American citizen.
Thank you.